There is a long-standing narrative that across the continent, anything labeled public is synonymous with failure. In healthcare, this reputation is built on decades of lived experience, long queues, empty shelves, and a sense that the system is designed to exhaust rather than heal you. But how much of this is an inevitable reality, and how much is a symptom of systemic governance gaps? And more importantly, is this narrative true for every African country? To understand the present, we have to look at universal health coverage. It is the guarantee that health services, from prevention to palliative care, are available to everyone, everywhere, without the fear of financial ruin. It is a metric world leaders use to track if a country is actually protecting its own. On paper, the continent is a map of extremes. The UHC Service Coverage Index places Seychelles and Algeria at the top with scores of 75 and 74, rivaling many developed nations. Yet, nations like Chad and Somalia remain at the bottom with scores as low as 29 and 27. Before we can look at the data, we must look at the evidence that fuels this perception of failure. In Kenya, for example, data highlights that at least 47% of public hospitals face critical shortages of essential medical equipment. In Gambia, the out-of-pocket burden on families has increased significantly between 2005 and 2023. The share of health expenditure paid directly by households nearly tripled, rising from 11.5% to over 33%. Thousands of skilled Algerian doctors have migrated abroad in search of better environments. To put that in perspective, in 2022 alone, over 1,000 Algerian doctors successfully passed the medical degree equivalency exam to practice in France. These snapshots of equipment gaps, rising cost, and migrating talent aren't just isolated stories, they are pieces of a larger puzzle. To understand how these forces shape a nation's health, we are following 5 countries that represent the full spectrum of the African experience: Seychelles, Algeria, Kenya, Botswana, and Gambia. The landscape is set, but the story is far from complete. In our next installment, we move from the narrative to the numbers.